So let's talk about the birth process. The birth process happens in 3 stages. The first stage is labor, and in labor you have oxytocin being produced. The uterus begins to contract. Oxytocin is even given as an injection, and you may remember that oxytocin is the cuddle hormone, which makes a mother feel very connected to her baby after the baby is born. And oxytocin is being produced in great amounts because a side effect of oxytocin is also that it causes uterine contractions. So labor, of course, is the stage that nobody likes. It's painful, but it is kind of... it's really sensationalized in Hollywood. Not everybody has this horrendously miserable labor that you always see in a movie. Some people do have a lot of pain, some people only have mild pain, some people have no pain at all. I actually have multiple relatives who, when they had a baby, they were, like one of them was walking through the mall and the baby just fell out onto the ground. And zero pain, no issues, didn't know she was in labor, not even sure if there was like a labor, it's just all of a sudden the baby was pushed out. And then her next children after that, she had to be on bed rest for 6 months of her pregnancy. So basically, as soon as she found out she was pregnant, go lay in your bed for the rest of your pregnancy, because otherwise you might lose the baby because they just fell out without any effort. So labor can be very different depending on the person. The contractions in the uterus begin to make the cervix dilate, and the cervix is like the mouth of the uterus. And that is usually kept really tight because, of course, you wouldn't want bacteria or anything getting up into the uterus, especially if there's a pregnancy. You don't want the baby falling out. And that begins to dilate or open, like this picture of the pumpkins, which is kind of a terrifying picture. But that's actually how big the vagina and the cervix get in order to allow a baby's big old head to fit through and out. Now, it's not like the vagina is just kind of like sitting there gigantically open, but it's kind of like, you know, there's an opening in a sock, but it's not like the sock always stays open. It's just when you put your foot through, it can open that large. So that's actually how large the vagina relaxes to. That's 10 centimeters. So the pain is, of course, due to the muscles contracting in order to help to push the baby out. So the muscles kind of ripple down the belly or down the uterus. And the uterus is a muscle, like it's a big muscle, and it kind of starts to push and squeeze the baby out in these waves. And when you are having your period and you get cramps, it's the same exact thing in smaller doses, depending on how bad they are for you. Sometimes it's really intense. If you've ever had a kidney stone, a lot of people say having a kidney stone is more painful than giving birth to a baby, or around the same amount of pain. So it's not exactly comfortable. But I am going to post a video for you guys to watch about orgasmic labor, where the brain has this amazing ability to convert pain into pleasure, which is why getting a tattoo can become addictive, because that pain can actually be pleasurable. So that'll show you another interesting side of giving birth. All right, and then you have delivery. Delivery is different than labor, right? That's why it's called the labor and delivery department, or you have a labor and delivery nurse. Delivery is the actual second stage where the baby is coming out. So this can take up to an hour. So when you hear people say I was in labor for 27 hours, they were in labor for 26 hours and then delivery for about an hour. This is when crowning occurs, of course, when the baby's head gets to the vaginal opening and starts to push out. Now, this is the point when the pressure of the baby coming out can actually cause the mom to tear. The skin can just kind of tear, and it tears between the vagina and the anus, so that's called the perineum. And this is where sometimes a doctor will cut that in order to, it's called an episiotomy, and that is to prevent tearing from occurring. Because sometimes the tearing can be so bad that it can actually rip from vagina to anus and from vagina to belly button up on the other side. That's how much the skin can rip because of the pressure of the baby. Now that is unusual, but it can be some bad ripping. Now, it is better, if you're not talking about a serious rip, it is better to rip than to have an episiotomy, because natural tears actually heal better than incisions in order to make the vaginal opening larger. So episiotomies, you want to avoid those, not at all costs, but at a lot of costs. Like, you do not want to have an episiotomy if you can prevent it. Some doctors are episiotomy happy, And there's so many things you can do to avoid an episiotomy. First of all, you can prepare for childbirth. So doing yoga, stretching, squats, things that can kind of begin to stretch out the pelvis area. You can do perineum massage, where you actually literally massage that area around the vulva and anus and skin in between. Sounds weird, but it's better than ripping. You can put like olive oil down there. Basically, you make the tissue more pliable. Also, during labor and delivery, taking different positions, standing up, moving around, turning. You can give birth on your side. You can give birth standing up. You can give birth sitting. You do not have to give birth laying down. And we're going to talk about that in a couple slides. But changing the position can actually decrease the chance of an episiotomy. The more you walk around prior to giving birth, the less likely you are to need an episiotomy. All right, and then the third stage is actually you've given birth to the baby, you've delivered, but it's not over yet. Sorry, ladies. You still have to expel the placenta and the umbilical cord. So the babies come out, but you still have what's called the afterbirth inside you. And of course, if that stays, it will rot and kill you. And that actually is a possible complication of childbirth. So of course, it's very important to make sure that expels. I breed animals, and anytime they have a baby, I watch to make sure that the placenta and umbilical cord has come out. So many times the nurse will come and torture you by giving you a belly massage in order to help that out. Just remember, like, there's something called obstetric violence, where for some reason when you are a pregnant woman, you become a piece of meat to the medical world, and they will do whatever they want to you in order to get that baby out. Now, the rest of the time, the baby's not a human being and has no rights, but now that you are in labor, suddenly you have no rights and it's all about the baby. It's this weird dichotomy in the medical field. And there have been many instances where women are severely abused. Women are held down, like you can't give birth standing up, you have to lay down, and literally they're held down. They're given medications that they don't want. They're given episiotomies when they're yelling, "No, don't cut me." I mean, there's horrific things that happen. So it's really important to know your rights, to have a birth plan, a written birth plan of this is how I want my birth to go, I want my labor and delivery to go. If you do not have someone in your family who will be there with you and who will stand up for you, then hire a doula or a midwife in order to do that for you. It is totally worth the cost. I mean, it's like $1,000 or less, but to have someone there for you to make sure that they're not like sticking their fingers up inside you too often. Like, you can actually specify, you can check me 5 times or you can check me 3 times. And that's the limit. Otherwise, you're gonna be constantly being checked to see how dilated you are. And you know, if you were just checked a half hour ago, you don't need to be checked again unless like birth is imminent or something. So if you're pregnant, you're gonna have a baby, you really need to read up on how you want childbirth to go and what your rights are. All right, anyhow. So we also do have some complications. Giving birth is dangerous, less dangerous now than it used to be, but unfortunately the United States, as good as our healthcare is, like as advanced as it is, of course we all know that there are tons of problems with our healthcare system, and one of them is that mother mortality rates are actually pretty high for a developed country. A country like the Netherlands, for instance, has a significantly lower rate of mother and infant mortality than the United States does. So why that is, I mean, there's all sorts of issues with that. Obstetric violence is one of them, that mothers for some reason lose their rights as soon as they go into delivery. I mean, I'm not going to get too much into it, but there are a lot of complications to childbirth, and being your own advocate, knowing what to expect, knowing what's normal, knowing how to talk to the doctors, and having someone there to advocate for you is really, really important. I mean, literally, it's a life or death thing when you're talking about childbirth. All right, so there are 2 major birth complications that cause problems with delivery. Failure to progress and a breech birth. Now, breech births, for some reason, doctors are completely phobic about these. And these are when the butt or the feet are coming out first. If the feet are coming out first, not too bad. But if the feet are tucked up and it's butt coming out first, there's not a lot of room for that baby to get through the pelvis and out the vagina. And the umbilical cord can also become constricted. It can get pinched off, which means the baby's not getting blood and oxygen from mom. And that can cause fetal distress and the baby dies. Now, you can have a natural breech birth. It's possible. A lot of women have died from it, so it is dangerous, but it is absolutely possible to have a breech birth. Now, you can also see the shoulder breech there, that is not possible for the baby to be born. That baby cannot get out. But butt first or feet first, the baby can get out. So if you are having a breech birth, usually you know far in advance from the ultrasounds that the baby's breech. If you can't get the baby to turn from like breech massages where you try to push the baby around in your belly, then you need to really advocate for yourself if you want to have a natural birth, that you want to try, and you do not want to have a C-section unless there are signs of fetal distress. If the baby is not distressed, then what does it matter if you try? Okay, and you know that by like the fetal heart rate monitor and oxygen levels and so on. Okay, so the doctor can tell you if the baby's starting to have some distress, and if that's the case, then you go into a C-section. But you can actually have a breech birth without having a C-section. And then you also have failure to progress when the birth process is just taking a really long time. And in this case, they will do one of two things. Generally, they will try to do a forceps suction out, where they basically put the suction cup on your baby's head and try to pull the baby out. That can have complications. It can cause the skull, because the baby's skull is not fused at this age, so it can cause it to become deformed, and then they have to wear a helmet to straighten it out. It can also cause neck problems because all the pressure that you're putting on the neck. So you want to avoid forceps suction if at all possible, and then of course you have the C-section. Now, a lot of doctors will push you to have a C-section when there's failure to progress before there's any level of fetal distress. If the baby is not upset and the baby's not in trouble, then what does it matter if you take another half hour or even another few hours to try to deliver this baby naturally? So again, and it's really hard to advocate for yourself when you're in this much pain. You need somebody there for you, your mom, your sister, a doula, whatever it is you need, somebody who is going to advocate for what you want and isn't going to pressure you to do what the doctor says. Okay. C-sections are not pretty. Okay, you do not want to have a C-section if at all possible. There are all sorts of complications to C-sections for both you and the baby. Babies who are born from C-sections often have other problems in life. They're more prone to obesity, for instance. I don't know why C-sections do that, but there are potential problems for the baby. But there are lots of problems for you as the mom. First of all, they are cutting through your skin, cutting through your fat, cutting through your muscle, cutting through your uterus in order to get that baby out. And most C-sections look like a butcher yard. They're not pretty, and they're usually not done very well. Both of my sisters had C-sections. One sister had an excellent doctor, and she doesn't have any problems from the C-section. The other one had a butcher doctor, and 10 years later, her oldest is 10 years, and she still has pain from the C-section. So if you can avoid it, avoid it. It leaves a scar, which isn't that big of a deal, but a lot of women don't like it. And it can also cause a lot of pain and pulling on the stomach, and it can hurt for the rest of your life. It can cause abdominal muscle problems. You can become sterile where you can't have a baby after that because it messes up your uterus. So it all depends on how good your doctor is at sewing you back up. Some doctors will only sew the uterus and the skin back up, but your muscle and your fat all has to actually be sewn back into place too. You can't just ignore that. Or you're going to have a lot of scar tissue and you're going to have a lot of other problems, okay? Also, if you have a C-section, a lot of people for some reason expect you should just snap right out of childbirth and just get back into it, and you need to be responsible for that baby and the house and your husband and blah, 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 blah. First of all, you have a baby naturally. That's really hard to do. You can't do that, okay? You do not feel good for at least a few weeks after having a baby. If you have a C-section, you're talking potentially months of not feeling good. You can't even stand up on your own. You just had your belly ripped open. If people expect you to bounce back from that right away, they're ridiculous, okay? So don't feel that way. Also, a lot of women will feel like they failed if they have a C-section, and you should not feel that way. While it's certainly not something you want to have, sometimes it's necessary. Like, it's better to have a C-section than for your child to die. But on the other hand, of course, it does have risks and ramifications. You could die potentially, from a C-section, from the surgery itself, or from an infection. Those are both possible risk factors. So avoid it if you can, but there's no shame in having a baby that way. Like, it's better to have a live baby than to be like, I refuse to do anything but a natural birth, and so I let my baby die. I mean, that's obviously that's ridiculous. Okay, so what things can you do to have an easier childbirth? Because a lot of women are terrified of having babies, and it makes sense, like it's a scary thought, but there are things you can do to have an easier childbirth. One of the biggest ones is whether you have the baby upright or laying down, supine position. So historically, women had babies standing up or sitting or squatting so that gravity worked in your favor, okay? Also, that position widens your pelvis, so it's easier for the baby to get out. That's one reason why women nowadays have more C-sections and more episiotomies, because since they're laying down on their back, the bones of the pelvis shrink, make the hole smaller rather than widen, which is what happens when you squat or stand. So there's less tearing when you are up in an upright position. Also, there's better oxygen. When you're laying down, the aorta tends to become compressed, and that's of course a big blood vessel, and so you have less oxygen getting to you and to the baby, which can cause the baby to go into fetal distress quicker. If you're upright, that doesn't happen. Also, it's easier to push, so being upright helps the uterus to contract better and obviously gets the baby out faster, but also puts the baby into a better position, head down, in order to come out. And then it also shortens labor, and this is all proven by research. You could get online and do the research yourself and see the research articles. Giving birth upright is much better than laying down. Laying down is just a recent phenomena in modern medicine, and it is not a good one, as you can see in this ancient statue, okay? Some other statistics. If you give birth in an upright position, you're 25% less likely to have a forceps or vacuum-assisted birth, and we talked about the problems with that. 54% less likely to have abnormal fetal heart rate patterns, which is the thing that triggers a doctor to say you need to have a C-section. You're 25% less likely to have an episiotomy, which you do not want. Now, these are the bad things. You're 20% more likely to have a second-degree tear. The chance of a second-degree tear is slightly more likely, but that's also because you're less likely to have an episiotomy. Okay, so the doctor is less likely to think you need it, and so you have a slightly larger chance of ending up tearing because you didn't get that episiotomy. Okay. Also, you are more likely to have a larger blood loss if you're upright, which makes sense because gravity is pulling the blood out of you instead of it pulling inside your body. But according to the study that was done, the results that they found were questionable, may not actually be accurate, and even if they are, 500 milliliters is about how much blood you would get taken in a blood donation, and that's not going to hurt you or the baby, okay? And there are no higher needs for blood transfusion, which shows that even if there is higher blood loss, it's not that big of a deal. All right, and cesarean deliveries in our country, the World Health Organization, WHO, recommends not to have a C-section rate of higher than 10 to 15%, but the United States has C-section rates around 30 or so percent. So one of the reasons is that the laying down position is encouraged. Upright positions are discouraged, and also doctors make a lot of money off of C-sections, and C-sections are much more exciting than a regular vaginal birth. So once you have the baby, the most important thing for taking care of the newborn is skin-to-skin contact. Research has shown that skin-to-skin contact increases the chance of that baby surviving tremendously. The baby will do much better if they are on your skin. It used to be like back in the 40s, 50s, 60s, they would take that baby from you immediately and you may not see it for days. And back then they even put you into like a twilight sleep where you were put under completely. So like my grandma always said, when she had her first baby in 1960, she doesn't remember it at all. She couldn't feel anything, and then she was basically out, and then a couple days later they bring a baby into her and say, this is your baby.